Hi, I'm Dr. Luqman Mazlan. I'm a colorectal surgeon in Pantai Hospital, Kuala Lumpur, and currently I'm also the president of the Malaysian Society of Colorectal Surgeons. Now, this procedure is done under general anesthesia, so the patient does not need to be awake. He will be asleep. The whole procedure should take about half an hour to an hour, and when the procedure is done, the patient is awake. For the patient, it feels like maybe 1 or 2 seconds. So what do we expect after the laser hemorrhoid surgery? Now, there should not be too much pain. There will be a little bit of discomfort perhaps, but nothing that is too severe. Of course, as a doctor, I will give antibiotics, some pain medications, and that can help with making the patient more comfortable. Now, usually the patient will be able to go home either the same day or even the next day. There shouldn't be so much pain. Now, of course, if we remove some skin tag or if we remove some external hemorrhoids, there will be more pain than if it's just purely a laser procedure. In which case, sometimes the patient needs to stay a day or two longer, but usually not more than that. If there is an external wound, the patient needs to be taught how to clean it. If there is none, then there is no cleaning needs to be done. Now, once the patient goes home, I will usually give a clinic appointment in about 2 weeks. I think all patients need to know and realize that any surgeries, whether big or small, will have a risk of some complications. Okay. Now, as I said earlier, the risk of a hemorrhoid surgery, the biggest risk is always injury to the muscles that control the anus. In laser surgery, that is almost non-existent. But there are other complications that can happen, like for example, if the patient has some wound infection or some, very rarely, the patient can have bleeding after surgery, and even an abscess may form or something what we call as an anal fistula. Those are very, very rare. But all I can say in summary is that laser hemorrhoid surgery is relatively very safe because it is minimally invasive and has very, very few complications. When the patient goes home, I will always tell the patient before leaving the hospital to watch out for a few things. If there is too much pain, if there is bleeding that is beyond just a minimum amount. Now, a little bit of bleeding or a little bit of discomfort is quite normal. But anything that is too much, that even the painkillers I give may not work, or if there's too much bleeding, the patient is worried, please come back to see me in the clinic. Now, I think it's very important during the counselling of the patient prior to hemorrhoid procedures to tell them that when you burn something, mainly you put a laser fibre and you burn the hemorrhoids will shrink. But it will only shrink up to 60-70% of the size. The remaining 30 or 40% will take about 4 to 6 weeks for it to shrink. So in the process, the patient might feel a little bit like a lump or something there in the anus. That's a normal thing. They shouldn't feel pain, right? It shouldn't bleed a lot, but they could feel something there. If that is the case, then do not panic, it is normal. However, anything more, anything that is distressing them, anything that is severe, they need to come and see me earlier. If there's some swelling at home, and sometimes there may be, all you need to do is put some ice in, wrap it with some tissue or some cloth and just apply it there. Now, it shouldn't be too much swelling, but if there is, that's what you can do. By right, the patient, because laser hemorrhoid surgery is such a minimally invasive, relatively painless procedure, they should be able to live their life like normal. In fact, they can go back to work like normal, they can pass motion like normal, within the next 1 or 2 days even. But my only advice is perhaps they shouldn't be doing too strenuous an exercise, they shouldn't be going swimming, for example, alright? And they certainly should not never insert anything up into the anus because it's a raw area, surgery just happened, you don't want to cause an infection or injury to that area. So that would be my advice. In terms of dietary habits, I think good dietary habits, like a lot of fiber, lots of vegetables, fruits, lots of water is good. I don't think you would require any special diet. Perhaps maybe avoid some spicy food because that tends to aggravate the pain or the swelling. But other than that, there is no dietary restrictions. Laser surgery is a very safe and viable option of treating hemorrhoids grade 1, 2 and even 3. The most important thing is to recognize the symptoms of hemorrhoids, which are bleeding, pain, mass per rectum. Get it checked because it may not be hemorrhoids, it may be something else. But if it is hemorrhoids, it is better to treat it earlier than wait. If you have bad habits of spending a lot of time in the toilet, remember to try to change that. Don't spend so much time. And if there's any bleeding, please come to see the doctors earlier.